Hello and welcome back to patient positioning. In this case, we're looking at Sims position. Okay, so here the patient lies between lateral and prone position with legs flexed in front of the patient. Okay, so the lower arm is positioned behind the patient. Okay, and the upper arm is flexed at the shoulder. Okay, and the elbow. So this position is usually used for rectal examination, treatment, application of enemas, examining women for vaginal wall prolapse, and so on. So the main difference is that the body restraints and padding are used to keep the body in a better position. The patient will be on their left side in this position with a straightened left leg, okay, and slightly bent right leg. So like the lateral position, this position is often used for certain type of surgeries. This position is also used for certain examination like we have mentioned about the rectum and the vaginal wall prolapse. What you need to watch for is that the RN needs to keep an eye out on the pressure injury side and also to watch for DVT. Thank you so much, and that is the Sims position.